So this is going to be how to access a port. We're going to start by verifying our facility policy and our orders. We're going to start, we're going to knock. Hi, Mr. Johnson. My name is Josh. I'm going to be taking care of you today. I saw that you needed your port access. Is now a good time to do that? He's going to say yes. It's good. We're going to position the patient in supine position, provide for privacy, do hand hygiene, all that good stuff. Then we're going to throw on a pair of clean exam gloves, and we're just going to palpate the port, verify that it's there. And at this point, we can grab our supplies. So we're going to have a alcohol pad. I'm going to grab them. Actually, I'll just verbalize it later. So dressing kit, alcohol pad, and then a needle that we can access the port with. And we're also going to put a mask on and then give a mask to the patient during this procedure. If he can't tolerate a mask, we could just ask him to turn his head to one side. So now we're going to open up our dressing kit. We would also raise the bed, but this bed does not raise, so we're just going to do the best we can with what we have. So we're opening this up. We're being careful not to touch anything inside of it. We're just touching that outer border, not outer border, but the side facing down is the only thing we can touch currently, because we don't have a pair of sterile gloves on that we can use just yet. But before we put those on, we're going to open our access needle, and we're just going to kind of dump that onto our sterile field. Now at this point, we can apply our gloves, and we're keeping our sterile field above waist level. We're not turning our back on it. All that good stuff. So don't use your patient as a trash can in the real world. That's not cool. We'd also grab a lure lock. Now the reason I didn't grab one here is because this one already has one attached and it's like stuck on there. So we're just going to roll with it. We can also go ahead and take our pre-filled syringe and prime our tubing. Make sure we've got saline coming out of there. And we're not going to disconnect, however, we are going to go ahead and clamp our line. At this point, we can take our chlorhexidine, snap it, and kind of clean the port area in a basket weave hashtag type motion. So up, down, side to side. Just make sure we really get in there and clean the skin good. So we're going to let that dry for a minute or two, and then after that's done, we can grab our access needle, use one hand to palpate the port. It's our left hand. And then we can go ahead and place the needle in the center of what we're palpating. We're going to make sure it hits the bottom. We're going to unclamp our line and aspirate for blood return. And after we see that blood return, we're going to flush with 9.5 mLs normal saline in kind of a push-pause motion. We're only doing 9.5, not 10. Because if there's air in there when we try to do 10, that can cause problems for our patient. At this point, we can disconnect our syringe. Steril's over at this point. We'll connect any fluids if we need to, you know. We're gonna document the size needle we used. But before we do that, I'm gonna take an alcohol pad and kind of clean just around that area where the chlorhexidine was. And then we're going to apply our Tegaderm. So with that Tegaderm, we're gonna make sure we don't have any air bubbles in there. Gonna go from bottom to top and just kind of get all the air out of there, and then we would tape it down if we absolutely needed to. We're gonna document our name, date and time on the dressing itself, and then we're done at this point. Make sure our line's clamped, or if there's fluids running, we could make sure that they're running. Document how the patient tolerated, document the size needle we used, make sure he's in the lowest position, clean his table off, make sure he's got everything he needs, make sure he's got his call light, and then we'll be good. All right, thank you.